Hello everyone, Simon Ashall here. This is Health Highlights. Health Highlights is a show about health professionals, and the people and the stories behind the names that we hear about that we seldom get to meet. And today, we have the great privilege of speaking again to Dr. Chris Hayes, who's the pain specialist at the John Hunter Hospital, and also basically the head of the Dean of the Facility of Pain throughout Australia. So welcome Chris, thanks for coming again.
Thank you Simon, good to be here.
Now you're a very busy man, and one of the things that you do in your pastime is run marathons. How did you get into marathon running?
I think my friends say this is my personal pain research.
Oh, I'm sure it is. It's so painful, but obviously you enjoy it.
I do, yeah. My daughter has a phrase that's type 2 fun. So type 1 fun is obvious fun.
Yes.
That there's a simple enjoyment. Type 2 fun is a more complicated fun that you might tell your grandchildren about in future years. So yes, perhaps in some masochistic sense, there's part of me that enjoys it.
Well, good on you. I think it's amazing to have our goals, and obviously you need the stress relief, and that's a good space just to think, isn't it?
A challenge, a goal is always a good thing, and I do find it very good for my mental health, I would say.
Very good, very good. So, I've heard you speak quite a few times about pain and pain management, and your philosophy around pain management. So, can you share with us around how, firstly, a little bit what actually is chronic pain, because it's something that is really plaguing our community. So what is your basic definition of chronic pain?
Pain that goes for longer than a 3-month period is the definition. Or another way to express it, pain that goes on for longer than the tissues would usually take to heal.
Okay, wonderful. And so then you talk about integration and the effectiveness of integration around helping people with chronic pain. So can you maybe talk a little bit, what does integration look like for you when it comes to dealing with chronic pain?
Integration is a good word because you can take it at multiple levels. I think from a health system perspective, there's the integration between primary care, sites like Attune, and what's happening also at the specialist end at John Hunter Hospital, so good integration, helpful there. Also, you can look at the time frame, so integration between the health services that treat people early on after, say, a motor vehicle crash and acute injury, and what happens later on down the track. And then you can talk about integration also within one's own being, so integration of the mind, body, nervous system, all of these things play a component part of that as well.
Okay. So in terms of the way that you do things up at the John, what does the philosophy of integration look like in the way that you deliver care to the clients out there?
What we aim for is a broad approach, so holistic is good, and we want to integrate all of those aspects. So we often demonstrate this with a hand and 5 fingers is our simple model. Yep. You can divide up holistic care in many different ways, but we talk about the biomedical aspects, so that's the medical treatments that act on the bio or the body, and then we transition to mind-body, looking at the way my mind, my thoughts and my emotions impact my physical health. Then connection with others, with the environment, beyond ourselves. Then physical activity, and finally nutrition, recognising that all of those aren't totally separate, they do interweave. I need a thought before I undertake a physical activity and so forth, but really we're looking to interweave all of those 5 aspects when we are working with people to assess their pain experience and also moving into the treatment phase.
Awesome. And so obviously through that model, you're saying that chronic pain is caused by a multiple of factors. It's never just one thing that causes it. There's usually a combination of things.
Yes, usually we're trying to get away from a linear model,
Yes.
A plus B equals C, so usually we talk about multiple contributors rather than just one simple cause.
Wonderful.
And there can be contributors in any of those 5 key areas.
And so in a comparison to, say, a linear model, which has been in the past done,
Yes.
and now the model that you're seeing with this integration, what are you seeing are the great benefits to the clients? Are there benefits, or and what is the research showing you?
Yes, I think it works better is one thing. So a linear model may work well in limited settings, but mostly in chronic pain it doesn't work. But if I can take maybe an example of where it might, if someone has chronic pain related to severe osteoarthritis of a hip joint, in some situations a hip replacement is a simple surgical fix, and that may solve the problem. So that would be a linear model and a biomedical treatment. But unfortunately, 9.5 times out of 10, 95% of the time, there isn't a simple medical fix, and therefore going broader is better, and it's good for not getting people locked into the medical merry-go-round that may be unhelpful. We see a lot of people with chronic pain who do that, and I think it is empowering to know that there are multiple options that they can work in. I am enthusiastic about the mind-body aspects.
Yep.
There's also a freeing aspect to the patient in this. I may be thinking deeply about mind-body connection as it relates to their circumstance. They may be reluctant to go down that pathway, but a broad approach means that they can work on their activity and nutrition as safer alternatives. So there are many benefits to going broad.
Wonderful, wonderful. And so I think that's probably one of the biggest questions that we ever get asked is what actually contributes or causes chronic pain? And from your 25, 30 years experience in the industry, what would you say are the key factors that cause people to have chronic pain?
That is a big question.
It certainly is.
I mean, one of the aspects that we talk about a lot is the role of the nervous system and the brain's perception, so that we say that all pain is caused by the brain at one level. So pain is a brain interpretation. So really anything that changes the brain's interpretation can be a contributor to chronic pain. So really it's the way the brain, and then we're springboarding off that to the mind, it's the way the brain and the mind interpret experiences in life. Life inevitably has its ups and downs, and its skin knees and its injuries. It's really how we respond to those things that determines whether we get chronic pain or not, and that is a lot about brain interpretation. It's a lot about the state of our minds as we go through life.
So, and that's an interesting point, because there's a lot of people that say, oh, you know, it's just in your head. And you're not saying that at all. You're saying it's the interaction of the body and the brain, and there's been maybe something that's happened there that's created a problem.
There is an old-fashioned way of saying that the pain's all in your head, in almost a linear model where we think of the mind and the body as separate. In that old-fashioned way of talking, we're saying if pain is all in someone's head, that there's nothing in their body to contribute to it, and perhaps they're making it up. So that's a very judgmental and unhelpful way to say that. On the other hand, in the new way of interpreting pain being in the head and in the brain and the nervous system, you can use that in a much more integrated sense. So yes, my brain does happen to be in my head, and that is a key aspect of my experience of chronic pain, but it still allows for multiple contributors, so it's not boxing someone in and judging them.
Absolutely. And so what role then does, say, stress and anxiety and our emotions, when we do get pain, actually play in actually taking us down that journey of potentially getting chronic pain as well?
I think they are big contributors potentially. Certainly there's a lot of overlap between anxiety, depression also, so that a lot of people who would experience chronic pain also would experience anxiety and depression. That is a bi-directional relationship, it seems, so sometimes the anxiety can be made worse by the pain. On the other hand, it can work in the reverse direction, so anxiety can clearly be a contributor to the pain itself, and if I am anxious, that's my habitual mental state, that tends to make me feel less safe in life, and my brain is more likely to interpret pain in a circumstance where I'm feeling under threat or anxious.
Okay, and so that probably leads to my last question. How do we, as people out there, how do we avoid getting into that cycle of chronic pain? What would you say is your top, say, 5 or 10 tips that you could give us to actually say, you know, these are some of the things that if you did this, it's going to really help when you've had an injury to actually not go down that cycle?
So again, the prevention is a big question. I think it's still helpful to think about the 5-point plan. So I think it is wise to weigh up carefully the medical treatments. I think often the trap I see is that people overweight the medical treatments and potentially underweight the other 4 fingers, meaning less self-management than is ideal. So to just be aware that although medical treatments can be good and have their place, there comes a time to move past those and focus in other directions. I think that's helpful. From the mind-body perspective, I think it is always very interesting anytime one has a physical illness or a problem to just ask, what is this telling me about my stress levels? You know I would use my own health in that way. If I get sick with a cold or anything else, it's good to ask, am I under stress? And usually I am, and that is the little reminder that I need to change life around a little bit, go for a nice long run, sleep well. So very good to use our illnesses as a little question point for what's happening in terms of my mind and my emotions. From the connection point of view, I think it is good if we are well connected. So as humans, we feel safe when we're connected, surrounded by safe people, positive role models and so forth. So that is a highly protective thing. So if I'm well, that's a benefit to me, but particularly if I've been unwell, thinking about who is on my team, are the supports around positive, can be a very helpful thing in seeking out supportive health professionals, as well as hanging more with the supportive friends as opposed to the less supportive ones can be part of that. Physical activity is good, like for all of us at any time of life. Even if we're aged 90, staying active and maintaining strength, particularly a lot of the evidence at the moment seems to be focusing more on strength as opposed to flexibility, but a lot of evidence coming in now that at any time of life, by building strength, we will add to our quality of life and probably our length of life also. And finally, thinking about nutrition. So if I have had the misfortune to be in a car crash, if I'm eating well in the recovery phase, that will set the scene for faster recovery. If I eat poorly, if I don't eat enough vegetables and eat a lot of refined and processed food, sugary foods, then my process of recovery will be prolonged. So really prevention is about broad societal approaches and public health approaches.
Wow. Well, that's very interesting insight, to be honest. And I think that the key there is that, as you build that health up in your system, your body's able to combat whatever illnesses come its way. And so therefore, what you're saying really is that that's going to help break potentially that cycle, that you don't get into that chronic pain cycle. So thank you so much, Chris. We really value your time. There's been some amazing wisdom that you have shared with us. So thank you so much for taking the time. Thank you also for joining us. It's been great to share with you around the area of chronic pain, which is such a issue in our community. If you want to find out more about Chris Hayes, all the work that he does at the John Hunter Hospital, you can check out his website, and there is a contact number below that you can actually contact the hospital with. Look, thank you for joining us. We're going to have an incredible interview for you next week, so stay tuned. Same time, Wednesday, 12:30. We look forward to seeing you then. Remember, healing is a gift, health a responsibility. Have a great week.